Testing MC abduction. Patient's hand will be on a flat surface or table as shown here. The first thing you'll have your patient do is perform full abduction of all of her MC joints. So go ahead and spread those fingers out for me, Rach. There you go. Now, because she was able to do this, we know that she is at least a grade 3. Also, keep in mind that the third digit goes ulnarly and radially into abduction. So we will be testing it going both ways. So go about halfway with those digits for me, Rach. There we go. So if we were to test the second digit abduction, MC abduction, I will stabilize the desired metacarpal, and I will apply resistance on the radial side of the second digit, and I will be forcing it into adduction. So go ahead and resist me, Rachel. 3, 2, 1. And then for the middle finger, I will stabilize, and then radial, 3, 2, 1. Ulnar side, because it's both sides, 3, 2, 1. Ring finger, on the ulnar side, 3, 2, 1. And then pinky ulnar side, 3, 2, 1. Now, if she was not able to perform any range of motion in this position, I would palpate the dorsal interossei, which is found between the metacarpals. So there is a dorsal interossei here, 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 and here. If I feel those muscles firing, that is a grade 1, and if I do not feel them firing, that is a grade 0.